Hi, and welcome to this tutorial of Tacan 3D. Today we would like to present the first software that incorporates the software model in the administration of anesthesia with Remifentanil and Propofol. What is Tacan 3D? Tacan 3D is an innovative software that incorporates the synergic interaction between Remifentanil and Propofol in a very user-friendly interface. Before explaining how this innovative tool works, let's review the different aids that anesthesiologists have in order to administer these medicines. One of the objectives of the anesthesiologist is to ensure that the patient is in a proper anesthetic level. This means that the patient has an adequate depth of hypnosis. Pain indicators show absence of this, and neuromuscular relaxation is appropriate for the patient procedure that is performed. Different drugs are available to achieve these objectives, which must be administered as accurately as possible. One of the ways to administer medications is based on the administration of the dose based on the weight of the patient. Considering the weight only for administering a medication would seem indicated only for medications that do not require infusions in time or drugs that do not have pharmacokinetic models. Administer medications with the help of pharmacokinetic models, incorporated in an application, a simulator or a target-controlled infusion (TCI) system. In principle, it seems the ideal tool, since we can estimate the plasma levels and the effect of the drugs that we are infusing. However, the difficulty of this principle is that the drugs have a behavior when they are alone, and a very different one when they coincide with others simultaneously in the effect site. Although this pharmacokinetic form aims to establish a desired concentration, it ignores the pharmacodynamic interactions of the drugs, addition, synergy, or infra-addition. The use of surface models to show the pharmacodynamic interaction of two drugs is available in some anesthesia workstations. The best known are Anesthesia Navigator Application Suite and the Anesthesia Smart Pilot View. Both systems estimate the pharmacodynamic interaction of the drugs and in a 2D graph allows visualizing the patient's position with reference to the non-responsive probability curves. The main weakness of this system is that the interaction model does not use the probability of non-response, PNR, as an objective variable. For these systems, the PNR is a variable outcome that is calculated based on the doses that are being administered. This means that the anesthesiologist, despite knowing the PNR, cannot adjust or modify it according to the anesthetic requirement. Administering a medication based on the clinical response to pain, and the depth of hypnosis becomes a promising future. Nociception level index, bispectral index, and SED line. They are tools that allow the anesthesiologist to assess the response to pain and the depth of hypnosis during a general anesthetic. These systems aim to modify the infusion of drugs in the event of a response, making them the future pillars of any navigation system. Tacan 3D is the first 3D software that incorporates the surface model and allows its interface to handle the concept of space as a function of time, allowing to modify the PNR and the time to reach said NPR. For Tacan 3D, the PNR is the objective to be achieved in a stipulated time, and this PNR will be modified according to the variables of hypnosis, pain, and the adjuvant drugs administered. Tacan 3D is the first software that allows visualizing in which spectrum of the surface model the patient is navigating. The PNR, or probability of non-response, can be considered in anesthesia either as a consequence of selecting target drug concentrations and observing which PNR correspond, variable of outcome that is the form usually selected by anesthesiologists, even in intentional, or as a factor that we choose and that will determine the concentrations of medicines necessary for said PNR, objective. Let's observe with a clinical case the importance of being able to have the PNR as objective and not as a variable outcome. We are in surgery on a male patient who is undergoing a laparoscopic cholecystectomy. The systolic pressure is 100 meters mercury. The heart rate is 60 beats per minute. The nociception index is adequate, and the bispectral index goes from 45 to 35. The anesthesiologist is using a target-controlled infusion system and has adjust concentrations of remifentanil in 5 nanograms per milliliter and propofol in 3 micrograms per milliliter. How can you interpret this? The patient is in a plane of adequate analgesia, but probably on a plane of hypnosis greater than required. Considering the suprapositive interaction of both drugs, if the anesthesiologist modifies the infusion of the hypnotic, he must also modify the remifentanil so that the patient continues in the same nociceptive plane and decreases the hypnosis plane. If this is not done, when the hypnotic is diminished, the anesthesiologist will meet a patient who leaves the appropriate plane for the procedure. The difficulty in this situation is how to calculate the infusions of the drugs to continue in the same analgesic plane and upload the BIS. This 2D graph represents the remifentanil concentrations on the y-axis and the concentrations of propofol on the x. The TCI systems can calculate the infusions of medicines to reach the concentrations that we choose. However, this information represents isolated data. If we bear in mind that when administering remifentanil and propofol, they interact in a synergistic manner and that the TCI system does not integrate the information of said interaction, it simply responds to the infusion for the concentration that we choose. As we see in the graph, the TCI systems and some simulators will only allow us to move on the 2 axes. This is the main shortcoming of these systems. The most modern software incorporates 2D graphics, where we can estimate the synergic interaction point of the concentration we have adjusted. This is a great advance because it is possible to know, with the information of the concentration of remifentanil and propofol, in which PNR curve the patient is. Despite knowing the patient's PNR curve, the PNR is considered as an outcome variable and not as an objective variable. That is, according to the infusions administered, the concentrations can be estimated, and with these, the point of interaction. More do not give the opportunity to select a point in one of the curves, and based on this desired point, calculate the concentration and infusions required to reach that point. Returning to the clinical case, if we consider that the patient is at a suitable point regarding the probability of non-response as reflected by heart rate, blood pressure, and nociception index, but the bispectral index went from 45 to 35, indicating that we should lower the concentration of propofol. But what happens if we lower the concentration of propofol? If we have a TCI system, this will only allow the concentration of propofol to be adjusted, in this case by the bispectral index data. It would be necessary to decrease it. If we have a system that can estimate at which point of the curve the interaction is, after lowering the concentration of propofol without modifying the concentration of remifentanil, we would see how the probability curve where the patient was changed. This can mean that the anesthetic plane was modified by changing the probability curve of non-response. A more accurate option, given the patient's clinical situation, would be to be able to continue navigating on the same probability curve, with a lower propofol component to be able to correct the bispectral index without taking the patient out of the plane. This would necessarily imply an adjustment to the remifentanil concentration. So far, the available software has a representation of the synergic interaction curves in 2D, and they overlook the construction of the 3D surface model, where there is a clearer representation of space and time. Incorporate the PNR as an objective variable, having the possibility of selecting a desired point in the surface model, and based on this point, calculate the concentrations and infusions needed to reach this goal in a certain time. It is a challenge and a need in daily practice. Tacan 3D. It is the first software that incorporates the surface model in 3D, where the administration of anesthesia is transformed into a concept of 2 variables, space as a function of time. Tacan 3D is an innovative software where the anesthesiologist can select a point in the space or in the surface model and determines the time in which he wants to reach that point. Once the objective and the time to reach it have been selected, the software establishes the concentrations of remifentanil and propofol and the infusions required to reach this objective. To navigate in Tacan 3D, it is highly recommended to use the monitoring of the depth of hypnosis and as much as possible the monitoring of nociception.